You've probably been told that tingling in your hand is carpal tunnel. But what if I told you it's not always coming from your wrist? In fact, the real cause could be higher up, in your neck. And if that's the case, wrist braces or stretches aren't going to fix it. In this video, you're going to learn what's really causing that tingling and numbness, how to tell if it's coming from your wrist or your neck, and what you can start doing right now to begin feeling better naturally. Stay with me until the end because I'll show you one simple exercise you can do at home that might give you relief in just a few minutes. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. I help people get relief from disc bulges, sciatica, pinched nerves, and chronic spinal issues without surgery or medication using chiropractic corrective care. Subscribe now if you want simple exercises and proven tips to help you feel better, move better, and stay pain-free. When people start feeling tingling or numbness in their hands, the first thing they usually hear is, it's carpal tunnel. And sometimes that's true, especially when the tingling is mostly in the thumb, index, and middle fingers. But here's what most people don't realize. These same symptoms can also happen when one of the nerves that starts in your neck becomes irritated or pinched somewhere along its path. The nerves that control your hands begin in your neck. They exit between the vertebrae in your neck, travel through the shoulder, down the arm, and finally into each of your hands and fingers. If that nerve in the neck becomes compressed, whether from a disc issues, tight muscles, inflammation, or poor posture, it can interrupt how that nerve sends signals. And when that happens, you can feel tingling, numbness, or burning in your arm and hand, even though your wrist is perfectly fine. Think of it like a garden hose. If the hose is kinked near the top, the water doesn't flow properly at the end. Your nerves work the same way. If there's pressure or irritation at the source, you'll feel it where the nerve travels, not always where it starts. So, before assuming it's carpal tunnel syndrome, it's important to look at the entire pathway from the neck to the shoulder, down the arm, and into the hand. That's the only way to uncover whether what you're feeling is truly carpal tunnel or if it's actually a pinched nerve higher up. So, how can you tell whether your hand tingling is actually carpal tunnel or if it's coming from your neck? It really comes down to where you feel it and what makes it worse or better. If your tingling stays mostly in your hand, especially the thumb, index, and middle finger, and it tends to flare up with typing, gripping, or bending the wrist, that's more consistent with carpal tunnel. That's when the median nerve gets compressed in the wrist and symptoms stay below the wrist joint. You can also do what's called Tinel's test at the wrist. Gently tap over the carpal tunnel. If that triggers tingling or an electric-like sensation into the same fingers, it's a good indication of carpal tunnel syndrome. Always remember, this video does not replace an evaluation by a doctor. It's always wise to get checked by a healthcare provider for an accurate diagnosis. Now, when it's a pinched nerve in the neck, also called cervical radiculopathy, the pattern is very different. The discomfort usually starts in your neck and can travel through the shoulder, down the upper arm, forearm, and into the fingers. Any or all of the fingers can be involved, depending on which spinal nerve is affected, not just the thumb, index, and middle finger. These symptoms are often aggravated by certain neck positions, like bending your head to the side, looking up, or turning for a long period. That's because these movements put more pressure and tension on the nerve as it exits the spine. There are also a few other conditions worth knowing about. One is thoracic outlet syndrome, which involves irritation or compression of the nerves or blood vessels in the lower neck and upper chest area near the brachial plexus. This can send pain, tingling, or numbness down the arm and into the fingers. Another is cubital tunnel syndrome, which starts at the inner elbow. This one typically causes tingling or numbness in the ring finger and especially the little finger. But the key point to remember is this: when the issue starts in the neck, the symptoms can appear anywhere along the nerve pathway, from the shoulder all the way to the hand. That's why understanding the source of the irritation is so important. Common causes of a pinched nerve in the neck can include a disc bulge or herniation at C5-6 or C6-7, degenerative arthritis, forward head posture, a reversal of the cervical curve, or even instability in the vertebrae known as anterolisthesis. When you know which part of the pathway is affected, you can finally focus on fixing the right problem instead of just chasing symptoms. Once all other causes of numbness and tingling in the hands has been ruled out, and you've confirmed that it's coming from a pinched nerve in the neck, the next step is to correct what's causing the nerve irritation in the first place. Because when you correct the underlying cause, you not only relieve the numbness and tingling in your hands, you also help prevent it from coming back again. There are 3 key things that make the biggest difference. Number 1, chiropractic adjustments. Gentle and specific adjustments help restore normal motion and alignment in the cervical spine. When the vertebrae move properly, pressure or irritation on the nerves begins to ease, which helps the body restore better nerve flow to the arms and the hands. Number 2, exercises. Once the pressure starts to reduce, targeted mobility and posture exercises help stabilize the neck and shoulders. These movements strengthen the muscles that support proper spinal alignment and keep tension off of the nerves long term. Number 3, spinal decompression. In many cases, decompression therapy can help open the spaces between the vertebrae, reducing pressure in the disc and nerves. This creates the environment the body needs to recover, reduce irritation, and restore healthy nerve function naturally. I go into more detail about cervical decompression and chiropractic adjustments for a pinched nerve in another video. I'll put a link to it in the description section below. So, when these 3 approaches, adjustments, exercises, and decompression work together, you're not just chasing the symptoms anymore. You're fixing the reason the nerve became irritated in the first place. Now, I want to show you a simple movement you can do at home that can help take the pressure off of the nerves in your neck. It's gentle self-cervical decompression exercise using a towel and a chair. Here's how to do it. Grab a small towel and roll it up lengthwise so it's firm but comfortable. Then get down on your knees in front of a sturdy chair and place your elbows on the seat. Bring the towel behind your neck so it sits right at the base of your skull, just below the ridge where your head and neck meet. Now, holding one of the towel in each hand, gently pull upward and slightly forward, almost like you're trying to lift the weight of your head off of your neck. You don't need to pull hard, just create a light, steady traction. As you hold that position, you should feel a gentle release or stretching sensation at the base of your neck. Stay there for 10 to 15 seconds, then slowly relax. You can repeat this 5 to 10 times, keeping the movement slow and easy. It shouldn't cause any pain or dizziness. It should feel relieving, like pressure is lifting off your neck. If you notice your tingling eases slightly, that's a good sign that you've just reduced some tension along the nerve pathway. This is a great way to get temporary relief, especially if you spend long hours looking down at your phone or computer. But remember, you'll want to correct the underlying issues in your spine, posture, and nerve compression. Numbness and tingling in the hands can be frustrating and even a little worrying, especially when it starts to interfere with your work, sleep, or daily activities. Many doctors and therapists are quick to label it carpal tunnel syndrome, but now you know it can be something else, and one of the most common reasons is a pinched nerve in the neck, also known as cervical radiculopathy. You also learn that chiropractic adjustments, exercises, and cervical decompression can help target the root cause of a pinched nerve in your neck. Be sure to look for a chiropractor in your area who is skilled in treating pinched nerves and is also trained in using cervical spinal decompression. And if you give the self-decompression exercise a try, let me know in the comments how it worked for you. I'd love to hear your results. If you got value from this video, like it and share it so it can help more people who are struggling with the same problem. And be sure to subscribe if you want more simple exercises and proven tips to help you feel better, move better, and stay pain-free. If you've been having trouble sleeping at night because of a pinched nerve in your neck and that constant tingling keeps waking you up, go check out this video. I'll show you the best way to sleep with a pinched nerve so you can finally get a better night's rest. Go watch this video next.